Okay, I think I'm live. Greetings. It is hospital day 7, as in I've been in this dang hospital for 7 days now. Okay, anyway, updating you guys since we last talked. So, since we last talked, it was the day before my port surgery. As you can see, I had the surgery because there's my port. I will try to show it to you guys close up, but I don't think it'll like be very clear. Like I was saying, talked to you guys last. It was the day before my port surgery. Aw, thank you, Rhonda. You are beautiful too. And I was saying that I was going to go into port surgery the next day, but it didn't actually happen because they couldn't get me on the schedule. So it ended up happening the next day. So since we last talked, that happened, and I also started TPN about the day after that. So it's been like 3 nights now, 3 or 4 nights. None of that is new to me. I've been on TPN several times in the past. Oh, a nurse or somebody's coming in, so hold on, you guys. Yeah.
Hey.
Hi, I'm doing Facebook Live, so I'm talking as I talk to you.
Okay.
Hi.
I'm Angie, I'm your nurse assistant.
Cool.
I just gotta get your vitals, okay?
Oh, sure.
Okay.
I'm gonna get my vitals taken, you guys. So you guys are just gonna have to bear with me as I'm talking to you guys and getting that done. Like I was saying, TPN is not new to me. What? I know, I'm not good at that. Getting all my things done. Taking my blood pressure, see that? How awesome. Not really, I mean that's not awesome, but it's happening.
Did you need anything?
No, thank you.
Okay.
Yeah. I do Facebook Lives every now and then, so I have a website where I talk about my illnesses, and on my Facebook page there's 11,000 people who follow, so yeah, it's been fun. I've been talking to them while I've been in the hospital. Not that fancy,
It's so fancy.
but we have a big
But it's a
community.
good thing.
Yeah.
Because, you know, you're keeping people aware and everything. And
Yeah, we have a
some
big
people need that.
community of
That's good.
sick people there.
Because, you know, I had a patient in my home. They have sickle cell.
Aw.
So a lot of them are, like, when they're in the hospital, they get together. And,
Yep.
that's
Yep.
cool.
That's how we are.
2389. Good.
I have good blood pressure, in case you guys were worried. I knew you were.
That's really good. That's really good. I like
Cool. I got really good blood pressure, which actually that is good for me because usually my top number is like 90 something, and it's usually really low. So, but probably because I'm up and talking to you, I have like a normal person's blood pressure. And temperature. That's how you get your temperature taken. Just quick forehead thing, which is pretty awesome. Alright, sorry guys, just hang on one or 2 more seconds or something. Hi Vicky. And they don't know, Priscilla says they don't know who you are. What?
If you need anything, push call light.
Thank
We'll be
you.
back later. Okay. And let us know if you need anything too, okay? Okay.
Alright guys, done with vitals.
That was right.
So, what I wanted to remind you guys of, just because I feel like I've had to say this a billion times, but I have to say it again just because I've been frustrated. So, as most of you guys know, because most of you too have IBD, either Crohn's disease or ulcerative colitis, and I have Crohn's disease. A lot of you guys think that I'm in the hospital because of Crohn's disease, but I have to say again that I'm not here. Like, nothing of this is because I have Crohn's disease. My Crohn's disease is actually doing really good. Like, I'm in remission. None of this is Crohn's disease related. I have 2 illnesses that affect my digestive system, which is like really rare in itself. But like the second disease that I have, that I ended up with, is called chronic intestinal pseudoobstruction. It's a rare disease, so it's actually classified as a rare disease, meaning that there are less than 200,000 people in the country that have it, and it is very severe and disabling. And if I like thinking about that, like, I get really sad because it actually is like really not good illness to have. So I just wanted to say that again because I've been getting a lot of comments, especially on Instagram, but here too, just like thinking that I'm in here because of Crohn's disease and stuff like that, and I keep having to clarify. And I understand because most of you guys know me from my website, where like I talk way more about IBD than I talk about this illness, and a lot of that is because a lot of people have IBD, and so I have a big audience for that, but hardly anybody has the other disease that I have. So I don't really talk about it that often, but it's a progressive disease, which sucks. So that means over time it gets worse. And most people who have it end up in intestinal failure, which is where I'm at, and end up like either needing to be on TPN for the rest of their lives. And when that doesn't work out, like if you end up with liver failure from TPN, or if you keep getting sepsis or line infections or blood clots, or you don't have any access sites left anymore, then the only other option is a transplant. So they can do intestinal transplants, and they can actually transplant like more than just the intestine, but like the stomach and the liver and all of that stuff. So yeah, just reading comments. Will I start a website about SIBO? Probably not. I've thought about it, but just, I don't know, just because there's such a small number of people that have it, I mean, maybe that'd be good just because those people do need support. But I don't know. I probably won't. I'll probably just continue to share my story on Inflamed and Untamed and just keep talking about Crohn's disease because I have that, and then also talk about this because I have the other thing as well. But it has been frustrating with everybody thinking that I'm here because of having Crohn's disease, because I just want people to listen, and I hate having to repeat myself over and over. So in short, like, and I explained this a little bit the other night, but basically the peristalsis in my digestive system doesn't work. So like the movements, like your bowel and your stomach, everything contracts to move food and fluid and air through your body, and that does not work in me. Like, it's very weak and inefficient, and it affects my stomach and my small intestine. We've never tested my esophagus, like, so technically we don't know for sure, but my specialist thinks that like my whole system is affected, and it's gotten so bad, like, that like I'm just, my quality of life has been just shit and getting worse and worse and worse, and this year too, like just even in the past 4 months things declined really fast. So Anne asks if they're related. No, they are not related. It's very rare to have this illness to have chronic intestinal pseudo-obstruction, but so it can be either like idiopathic, like no known cause, but it can also be secondary to other illnesses. But Crohn's disease is not one of them. Like IBD and this illness are not related in any way. But there are other illnesses where you can get SIBO secondary, but IBD isn't one of them. So with that said, and feel free to ask questions as I'm talking, I will talk about my port and the surgery and how that went, and I'll talk about TPN a little bit. I'm doing a giveaway. I'm going to give away a Vogue mask, 2 of them in this Facebook Live, and then I have a lot more to give away in other areas of social media. So my port is right there. I don't know if you guys can see it very well. It's a double lumen, so there's like one line here and one line there. And a port is completely like underneath your skin, so if it wasn't accessed right now, if we pulled the needles out, then you wouldn't be able to see it. It's like completely underneath my skin, so you would just see like a little raised bump of skin where it is underneath my skin, but it's nothing that you can see otherwise. But when it's accessed, meaning that you have to stick the needle into your skin and into the port, then you can see this part of it. So I had the surgery on, what is today, Tuesday? Last Friday, and they do it in interventional radiology. Aw, you guys are so sweet. Thank you. Reading your comments. How has the hospital stay been? Better than the past? In different ways. This hospital stay has been hard in other ways than it is in Michigan. Like, this hospital itself is really good, and the nurses are really good, and I like that I have a private room, but because the doctors here don't know me as well, because I'm in Chicago, by the way, and my doctors are in Michigan, where I'm from, but Dan, my boyfriend, who's over there, he's from Illinois, and I'm living with him, so we're trying to get most, like, the things that we can do in Illinois for me done, so we decided to start my TPN here in Illinois so I can be closer to home. but the doctors here don't like know my story. They've never really heard of this illness. Some of them like have heard the name or think they know what it is, but they don't know what it is, or they do, but they've never seen anybody as severe as my case, because this hospital like doesn't have a specialist like I have in Michigan. Like my doctor specifically treats motility diseases, and like all of his patients are most of them are gastroparesis, because that's much more common than chronic intestinal pseudoobstruction, but he only treats GP, gastroparesis, and chronic intestinal pseudoobstruction, and I'm sure he has some other patients with like other motility diseases too, but those are like the things. So like he knows my illness, and here it's just really hard. I've had to do like a lot of explaining, and there's a lot of misunderstanding, so that part's been hard. But the hospital itself is like way better than the University of Michigan's in a million ways. So anyway, port surgery. It's done in interventional radiology, and they do it, my tape is coming off. I just put on a new piece of tape before I started this. They do it under twilight sedation, so basically like the same kind of sedation that you do when you get like a colonoscopy or any kind of endoscopy thing. So you're not like totally put out with general anesthesia where they have to like put a breathing tube down you and all that, but it's just like twilight sedation. Everything was fine, but I did have a lot of anxiety going into it, and normally I wouldn't. Procedures and things don't make me anxious, but I think I've just been more anxious as a person lately, just because I've had so much going on, and I've had so many things go wrong lately in the hospital that now I'm just super anxious. So I was a little bit anxious going in, but everything was fine. And in the past, like for TPN and stuff, I've only ever had PICC lines, so, but my TPN was normally temporary in the past, especially when I had it for IBD. The last time I was on it for 9 months, and that was because of this stuff. And they would have kept me on it longer, but I basically took myself off of it because TPN scares me and I didn't want to be on it. But then ever since I took myself off, I've been practically like bedridden and living a miserable life because my body doesn't work. So that's the trade-off. Now I can live on TPN and hopefully feel a lot better because I don't have to put anything in my digestive system. TPN is not the best thing. It's good. It's like really good for things, and it saves lives, but it's also pretty risky. It comes with a lot of risks that aren't just like little, it's like life-threatening risks. So I don't like being on it, and basically only want to be on it if I have to, but I have to. I mean, things have gotten so bad. But yeah, this port, like I said, under my skin, blah, 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 it's accessed right now. It has it's like a double lumen, so I will always have one side accessed for TPN, which I'll have to deaccess and reaccess once a week. That's just how you do it. But I'll always have one side dedicated just to TPN, and then the other side I'm going to use because like now getting peripheral IVs in me is just like impossible, like getting regular IVs in me. I had one in my foot in radiology back in Michigan last time I was in the hospital when I went in for the GJ surgery. That couldn't happen because my insides are so fucked up. But yeah, so they're starting to use my feet for IVs, and that's just dumb. So the other side is there for whenever I'm in the hospital and I need other things like fluids or who knows what. So that's pretty much it about my port. The pain after surgery wasn't bad. It was pretty sore, and it lasted just about 2 days, and it was nothing unbearable. I had a lot of trouble just like lifting my arm up over my head, or using my muscle, like using that arm muscle in any way. Like I just couldn't move it. But that got better like really fast, and now it's pretty much good. It's just a little bit sore. And you can see like, so the port, like where it's accessed is right here, but like the line, like you can even see it when I turn my neck like that, like that's the catheter, and here's a little cut here too, like where they went in. The line goes all the way up into a big artery right above my heart. And there's not much to say about TPN except for it's going okay. We are trying a different kind of lipid tomorrow. We're going to see how that goes. Apparently they have to monitor me in case I have any sort of reaction, which that's kind of scary. Like, I wouldn't think that I would, but they're going to be watching me, and they want to do it during the day so that if I do have a reaction, then they will know. But if it goes well, then we will see if that like helps the nausea any, and I feel better with that kind of lipid. The only other thing we can do is we can try to like decrease the amount of lipids that I get and just do like the lowest amount possible, and possibly only put lipids in my TPN bags like 2 or 3 nights a week, and then the rest of it would just be the TPN without having the lipids mixed in. I will probably get out of here, they said probably not tomorrow, but probably 2 or 3 days from now, and we're really just finishing up some stuff and getting everything in order. So that's that, and then I should have a break for about a month, and then I have to go have a surgery in Michigan, and I will talk about that another time so that I don't make this super long. But yeah, I have to have a surgery done in Michigan, and then hopefully for the rest of the year I don't have to be in the hospital anymore. So let's get to my giveaway. So how am I feeling now any better? I'm trying to answer your questions as I talk. I feel a little bit better. I do feel better, and that's because they're managing my pain. I've been living in like really severe pain, and it's escalated a lot within the last like 2 or 3 months, because the dilation in my stomach and my small bowel is so bad, and even like when I was doing tube feeding, I just couldn't tolerate it. Nothing was moving, and I was throwing up a lot and losing weight and just in so much pain. I was basically spending my time in bed and always at home, and that's kind of how like the last year has been, with the exception of sometimes. So I'm feeling better because they've gotten my pain under control, and that's such a big deal for patients, because when you're living in pain, it affects everything. It affects your sleep. It starts affecting just like you get irritable and angry, and if you're just doing that like day after day after day, where you're in very severe pain and you can't sit up and you can't walk and you can't sleep because the pain is keeping you up, and you're just miserable, like that's awful. It's nice to have gotten in the hospital where they can control my pain, because I don't have pain medicine at home, like nothing like Tylenol, stuff like that, like over-the-counter pain medicine works for me because it just can't catch that severe pain. And we've tried other things that like gabapentin, because it kind of can help nerve pain, or certain antidepressants they say can help different kinds of pain, but like nothing can reach my really severe pain. But I don't have like pain medicine at home, like narcotics, like because I don't have prescription for that. So being in the hospital, it's nice because I like have gotten a few days to get that all like back under control and give me a few days of sleep, and just like it helps you feel comfortable and feel so much better. And then now starting the TPN and all that, then hopefully like that's gonna be a fresh start, and I can live with a lot less pain in my life going forward. So that'll be good and give me a better quality of life. Somebody wants to know how TPN works. Do they send you home with bags of nutrition? So yeah, that's a good question. I forget that not everybody knows about that. So TPN works, TPN stands for Total Parenteral Nutrition. And parenteral just means like not by like eating by mouth. It's like avoiding the mouth, right? That's like the easiest way to say it. So it's just basically getting all your nutrition by an IV, like bypassing the digestive system. So what they do is they draw your blood here in the hospital. They draw labs every night, and then they take a look at what you need. So they make TPN specifically for the patient. So they put the exact amount of calories that I need to help me like get to the weight where they want me to be, and they don't want me to like blow up real fast. They want me to gain like a pound a week, so they give me the amount of calories that I need. They put in there like the amount of fat, proteins, carbohydrates, vitamins, minerals, just everything, and they tailor the bag to you. So that's how TPN works, and then it's infused through your bloodstream. So my port goes into a vein called the superior vena cava, which is a large vein right above the heart, and then the nutrition is pumped through the bloodstream. So when you're on it at home, they set you up with like a home care pharmacy or team. When I was on it last time, I was in Michigan, so Michigan's pharmacy, like their home care team, they made my bags of TPN, and then they deliver a week's worth. So you will have like Monday through Sunday's worth of bags in your refrigerator, and then they'll send you the next week's like later on. So that's pretty much how it works. And they usually draw labs like starting out when you get home once a week, and then it'll be like once every 2 weeks, and then it'll be once a month once you're more stable. So hopefully that answers your question in a fast way, sort of fast way. All right, so quickly, sorry, I'm losing my voice. I haven't like had a drink of anything. I'm gonna do my giveaway. So I know that I don't like the chronic illness community has really gotten into the Vogue mask thing lately. I don't really use medical masks very much, but unless I feel like I really need to. So for me, it would be more like if I was in the ER and there's a lot of sick people around and I don't want to catch their germs, or possibly in an airplane or something like that. But otherwise, I feel like I don't need to protect myself, but there are sick people that do need to wear masks over their face more often. And some people have really gotten into wearing Vogue masks, which look like, I'll show you the one that I was wearing. Hold on, I'm trying to do this with one hand. I'm not gonna put it over my ears, but like this. Woo! I have a zebra one, and it has like this little filter on the side, if you can see that plastic thing right there. It is more comfortable than medical masks, because I feel like when you're wearing those, like when I start breathing in them, just, I don't know, I can't breathe very comfortably, and I get all hot and yucky. So this is more comfortable. And they got fun designs, so they sent me some for me, and they sent me some to give away to you guys, so that's what I'm gonna do. And they only sent me medium and large. I don't even know if they make a size small, but this one that I was wearing is a size medium, and it's pretty small. Like, it fits me pretty good, and I have a small face, and size medium works. So they sent me mediums and larges, so just like guess which size that you would want. And in this Facebook Live video, because I have a lot of these to get away, well, not like a lot, but more than what I'm giving away in this video, because I'm just going to give 2 away in this video. But I have more to share later, and I'll post somewhere on one of my sites later about those. So I'm going to give away another zebra one, like the one I was just wearing, but this one is in size large. And so if you feel like you need a size large, you might want to go to their website and see how their sizing goes, because I don't really know. I should have looked for you guys. I'll do that when I do the next giveaway. But I have zebra size large, and then this one is like a dark green, and this one is size medium. If you want to win one of these, just like put it, I'm gonna have you just put it in the comments, and just specify if you want medium or large, and then I'll pick the winner the day after I get discharged from the hospital, probably, or let's just set it for a week from now so we have a specific date. So like next Tuesday, and I'll do like a random generator, like number generator, after I get all the comments, and go from there. I'll do it scientifically somehow, so I'm not just like picking my favorite person. Like, it'll be random, I promise. I did my makeup today so I wouldn't look as bad as I did last time when I did a video. And yeah, I am one of those people that brought mascara to the hospital, so laugh at me if you want to. I don't care. I am who I am. Okay, alright you guys, so I'm gonna sign off for now because I'm tired and I want to go to bed. and stuff like that. And also spend some time with Dan. He's over there, I think, doing chemistry or something. He's always doing his homework. He's super smart. And also really awesome and great for keeping, I don't know how he keeps his head together with everything that's going on with me being in the hospital and him trying to be here for me and support me and stuff like that, and then being involved in so much in school and trying to keep up with that. And he does it very well, and he makes it look easy, and he doesn't complain, and he's just amazing. So I don't know, he's over there doing probably chemistry. Are you? Or are you doing, you're doing fun stuff, probably. He's probably doing something totally ridiculous that, I don't know. He just keeps shaking his head no, and he won't tell me. But yeah, I want to spend time with him and just relax and all that. But thank you for hanging out with me and keeping me company while I've been in the hospital. I've been looking forward to talking to you guys again since the last time I talked to you while I was here. Alright. Talk to you later, you guys. You can keep commenting, and I will make sure I scroll through later and look at your comments and make sure to read all of them and respond to anything that I can while I can. But if I don't get to it, it's not because I don't appreciate it. It's just because I'm sick. So, alright. Say bye. Bye.